안녕하세요.
Greetings. I'm Professor Kim Shin-young of Department of Conservative Dentistry, Seoul St. Mary's Dental Hospital. Today I'm going to talk about cause of failure of C-shaped root canals endodontic treatment. I'm sure you're already aware that the prevalence of C-shaped canal in Korean population is high. According to study in 2012, it was 42%. In 2018, it was 40%. In a recent study in 2022, according to the report, among Koreans in lower second molar, the prevalence was approximately 40%. All these studies analyzed CBCT. Today, I'm going to talk about a journal which addresses why the endodontic treatment failed in C-shaped root canal. This was reported in Scanning, which is a journal. This was not a CBCT image analysis. I analyzed the cause of failure. The number of subject, or N, was few. It was approximately 42. However, most of them were lower second molars. The C-shaped root canal failed and surgery was done. When we do C-shaped root canal treatment, how can we increase the percentage of success in endodontic treatment? We need to understand C-shape first accurately. This is Melton's classification. First, C1 is continuous C-shaped canal. Second, C2 semicolon-shaped canal. C3 separated canals. C4 a single round or oval canal. You need to understand the form and category first. In general, I use microscope. When I go in the orifice, I try to understand the shape accurately. If it is vague, even when I use a microscope, I use CBCT to understand the form of root canal. In the previous study, I looked at CBCT before surgery to look at different shapes in coronal apical area, C1 type. There's a type where it is continuous, a C2 semicolon type, C3 separated type, C4 single round oval shape. These forms were observed. I summarized them in a table. In coronal level, C1 type was approximately 45%. When we do endodontic treatment from the top, you can see the continuous form. On the other hand, on the apical 30 millimeter, there were a lot of separated types. You may think the separated type is more easy, but in the case of C-shape, the separated root canals are connected with isthmus. Therefore, how we address this, it determines the success of endodontic treatment. I looked at why C-shape endodontic treatment failed. Most of the cause was leaky canal. Even if you do endodontic treatment well, there was a bit of leakage. And due to the characteristic of C-shape, isthmus was also the cause. These were two primary reasons. If you look at clinical image, there's leaky canal. GP looks tightly filled, but around the GP, there's leakage leading to infection and surgery. Due to C-shape characteristic, there's isthmus around GP. Infection occurred in isthmus area and this led to surgery. When you do root to resection, calcification was done so much so that canal shape could not be differentiated. There was missing canal. In the case of this patient, this was upper number 6. Except for ML, you cannot see anything. Missing canal, overfilling. These reasons lead to failure of C-shaped root canal treatment leading to surgery. In the case of this patient, as I did surgery, I took some of resected root to figure out what is the cause. This is GP filling, isthmus, and the GP filling on the other side. I magnified these three areas. You can see on one side where GP filling is done. When you magnify it, although the filling is done nicely, there's leakage. If you magnify even further, there's residual bacteria on the isthmus area. If you don't magnify as much, it looks clean, but there's residual pulp. And on the other side of GP filling area, there's also leakage, and around that there's microorganism. How can we remove pulp tissue and microorganism perfectly? After removal, how can we seal it completely? These are the two factors that lead to successful endodontic treatment. I'd like to give you my clinical tip. When I do endodontic treatment on C-shaped root canal, I use full strength NaOCl 5.25, therefore it is 100%. I use a very thin 30 gauge needle to address the isthmus where it cannot be addressed using nighttime. I also use sonic and ultrasonic irrigation to increase the success of endodontic treatment. In order to maximize the effect of cleansing, I also use sonic and ultrasonic irrigation. Endoactivator is sonic product. The benefit of this product is that it has a plastic fiber tip. It is for one-time use. So there are different sizes, so the surgeon can use it very conveniently. If you want to increase the activation of irrigant, you can use ultrasonic product. In the case of Endosonic Blue, which was released recently, the ultrasonic tip is made of nitide. Therefore, when it is in contact with canal wall, people may get concerned about damage to the canal wall, but because it is made of nitide, the surgeon can use it more conveniently. This is the revision of the insurance policy as of May 2022. A new code is going to be introduced for endodontic treatment with a 40% increase in the resource-based relative value scale. I think this is going to have positive impact on more successful root canal treatment for C-shaped canals. I'm going to show you a case before I end my lecture. The patient worked in my dental clinic. In 2009, endodontic treatment was provided. I paid a lot of attention to it. This is quite some time ago. I'm not sure whether you see it, but I thought that filling was done really nicely. The patient continued to follow up, and I continued to see the patient at 5 years. The patient complained of inflammation on the gingiva. I did a tracing. Apical lesion was observed. There were no symptoms. In order to solve the lesion, intentional replantation was done. If you look at the image then, I thought that the GP filling was done very nicely, but there was a lot of leakage as shown in black around GP. I removed it thoroughly. MTA was used to do retrofilling. The patient came in recently. It has been 8 years since surgery. The patient continues to go on without major problems. What I want to emphasize is that when we do endodontic treatment or re-endodontic treatment on C-shaped root canal, we need to do our best. At times, intentional replantation may be necessary due to the structure of C-shaped root canal. And when I do treatment on C-shaped root canal, I always tell the patient of the possibility of surgery. I hope you bear that in mind. Thank you for watching.